This is Ray Stokes in the oral history section of the library of the Texas College of Osteopathic Medicine on Friday, the 30th of August, 1985. I'm pleased to have in my office today one of my colleagues and personal friend that I have known down through the last 11 years that he has been a member of the faculty here at the TCOM. I'm visiting with Dr. Earl Elf Starkey, and today is a very significant day in his life. He's finishing up a distinguished career in pathology, a specialized portion of his medical practice, and he's been here in as an associate professor of pathology now since 1974. And Dr. Starkey is the first full-time DO faculty member with TCOM. And I say this is a very significant day because this is the last day of your distinguished career, Dr. Starkey, as far as full-time employment is concerned. And my emotions are somewhat mixed because I personally hate to see you go. Dr. Starkey's getting ready to retire to a little farm or ranch that he's bought up in the southern part of, or the northern part, I guess you'd say, of the Ozarks, and the southern part of Missouri. And he's going to be leaving us here, and today is the last day of this fiscal year, so naturally he'll be moving, I think, next week. I've done all the talking now, Dr. Starkey. I just merely want to let you know that we're going to miss you. But let's go back to the beginning. Dr. Starkey, you came here from Kansas City. Would you kind of give me a little bit of an idea of why you came to TCOM, under what circumstances? How did you learn we were looking for you?
At that time, I had been negotiating with the, I think it was called the Greenbrier College of Osteopathic Medicine in West Virginia, which I think subsequently became known as
West Virginia
School of Osteopathic Medicine. And I had been down there off and on for interviews and aided them in making out a curriculum, etc., and so forth. And following my last trip and returning home, having not as yet signed the contract, I received a phone call from Fort Worth, Texas, from a former colleague of mine and good friend, Dr. Myron Skinner, who wanted to know if I'd be interested in coming to Fort Worth in the position as a professor, or assistant professor at that time, of pathology. And as we chatted, I began to feel that that perhaps the picture at Fort Worth was more entertaining and more pleasant than at West Virginia, because there it would be completely new quarters. It would have, you'd begin from scratch, and I wasn't quite looking forward to that. And
we had about 4 years on them, didn't we?
That's about right. The only difficulty, as I told Dr. Skinner over the phone, I said, apparently the pay scale is going to be slightly different. I can pick up $10,000 a year more at West Virginia than I can here. But in view of the fact that we had the physical plant was much better, more adequate, and I would have the association of Dr. Skinner, you and Dr. O'Shea, and the hospital and all those facilities if needed. And so I made up my mind over the phone. Yes, I will come. And we arranged a date for me to come and meet the dean, the then dean, Dr. Newell, and subsequently Dr. Coy. And afterwards I called long distance to West Virginia and told them I was sorry, but I was unable to come. And so having decided that, I arrived in Fort Worth on or around August 10th or 12th, signed the contract on the 12th of August 1974, and I was ready to go to work.
That would be, then you got here just a couple of months after our first class had graduated.
Yes.
First of June
yes.
prior to that. So then you're the class of '74 and the class of '75 you didn't know very well.
No,
but,
that's correct.
But
Didn't know them very
'76
well.
on up to the class of '85
That's
that
right.
just graduated, you know them quite well and worked with them.
Yes.
In the very beginning, the pathology department was much smaller than it is today, isn't it? In size and of course, say stature. I don't mean that, but I mean personnel-wise
Yeah.
and so forth. Can you give me a little bit of your feeling about the events that took place that caused some of the growth?
Well, I think that my first class was, I think, 56 students. And we had the little laboratory, student laboratory over in the building below Med Ed 1. And
That's
part
the
of
building that's now the
Yeah,
medical
yeah,
examiner's.
yeah. And I had been in conference with Dr. Newell a number of times, and part of the procedures at that time was
Excuse me now, Dr. Newell. Who is Dr. Newell?
Dr. Newell was then dean.
That's
of,
Ed Newell?
Ed Newell, Dr.
Right.
Ed Newell.
Right.
And we agreed that part of my duties would be to upgrade not only the Department of Pathology, but also the Department of Histology in anatomy, and whereby I was to prepare tissue slides of normal tissue slides, that is, and develop them for that department and for a fee. And and as well making pathology slides. The problem was at that time we didn't have much in the way of tissue to do this, and we were fortunate to have, from the pathology standpoint, a large old cardboard box filled with tissue, wet tissue, you put that in parentheses, of stuff from the old Taro laboratories. And I had no idea where it came from, and so my assistant histotechnician prepared these, as much of the tissue as we could use, to make pathology slides for the student slide boxes. And as far as the normal tissue was concerned, we really had none. And because obviously you don't remove normal tissue. And so the thought was that when autopsies would occur, why, we'd be able to go in and snip a little bit off here and there, but one has to be very careful in so doing, because you've got to have permission and so forth. And so I felt that the best thing to do would be to purchase this already done from commercial laboratories, which we did, quite a few. And then on some of the pathology tissue, we were able to find areas of normal tissue and use that, and then pass it on to the Department of Anatomy, Histology area. And this is what we did for some period of time. Also, during this period of time, I found it necessary to work up lecture material for the classes. We were lecturing 4 hours a week and a laboratory 2 hours a week, which meant that the total amount of material for 5 hours during the week was tremendous. And so,
what is that, Dr. Starkey, compared to what it is now?
Well, the same principle would be followed in terms of a given individual working up his lectures. But there, I had no specific lecture material prepared. I had left what I had been using at Kansas City School. So I many times was in from 7:30 in the morning till 5:30, 6 o'clock at night, working these out, and also different days working out these slide problems, and actually was making lectures probably the day before the lecture was to be given. And so I was just keeping up for the first year, until such time that many of these this material and slides, etc., were prepared. So now all you had to do would be to select it slightly before lecture and or lab time, and put it together and walk in and do what you had to do. Right. And prior to that period of time, the laboratory and the lectures had been well done, but it was rather haphazard or by chance, because we had to rely upon outsiders to come in and lecture, and never always was it in chronological order. In other words, a lecturer might come in and lecture on endocrine glands, whereby the students at that particular moment in time might have no background for that particular subject. And so what I had to do is to begin at the beginning and follow through, so that those people who were involved in lectures would be chronologically assigned to certain material and be prepared to deliver it at some point in time. And the fellows that we used there was Dr. Skinner, Dr. O'Shea, Dr. Schaefer, they were the MDs, Dr. Cerrone, and so on. And it was not too long before we dropped the MD group, and I ended up teaching all this all by myself for about 6 years, I guess, something like that, 7 years. And during this process of time, we tried to, we purchased equipment to elevate the procedures, to make them like purchasing microprocessors for processing tissue, and audiovisual materials for the students, and all in all upgrading the general course of pathology through the years. And at this present time, we now have, in place of only one individual pathologist, we have a total of 5 pathologists in the department, and they participate in the similar procedures as I did, and plus administrative work, the department, plus a laboratory, both chemistry lab and tissue lab, and all the necessary secretaries and clerks to take care of these processes. And
in your definition of certain areas there, have you said anything that is in relationship? I hear the term, and I know very little about, but I hear the term course director.
Oh, yes.
You've been a course director, I'm sure. Are you still the course director?
Well, automatically I was course director because I was the only one. You might say I was chief cook, bottle washer. Yeah.
Well, what are the functions, particularly, of the course director?
A course director simply sets up the course. He sets it up and gets it ready to be prepared, and there's a lot of educational processes that goes along in there with the course director's meeting group, the committee, in which what each course director does, like preparing a syllabus and or syllabi, and what he's going to do each year is read and evaluated. Areas that they feel should be changed or might be changed are selected, or you might go through this without any comment at all, fine, and away you go, and that's the way it's set up for the following year. And normally this is not changed. Once it's set up, it remains that way, with the exception of some changes that the Department of Medical Education might decide somewhere in the process of crossing the stream that they would like to have done. And this is the primary function of the course director. And during the departmental meetings, he also presents this, and anything that has to do with what I like to call the division, the teaching division, is involved with. All members are involved with these problems. They are assigned lecture material, and it's their job to get them ready to be presented at a given period of time which has been assigned to them throughout the school year. At the particular moment, I'm no longer course director because I resigned it.
Mm-hmm.
I resigned it, I think, last summer, roughly.
Right.
And we have a new course director that the chairman assigned to Dr. Fernandez, is now course director.
Yeah.
So I don't have to worry about that anymore.
Tell me, Dr. Starkey, pathology is pathology, but is there any distinctive difference or comparison, contrast between allopathic and osteopathic pathology?
No, absolutely not. It's probably one area in which there's absolutely no difference. It cannot be. You're dealing with diseased tissue, and there are a number of other things as well, but the disease or the lesion is what's important, and that's as important to the osteopathic pathologist as it is to the allopathic pathologist. And one of the reasons why pathology, with reference to the DEO, or Doctor of Osteopathic Medicine, and the allopathic, is that there's no differences, so therefore we all tend to be members of the same broad group.
Mm-hmm.
And for example, I'm a member of the American College of Osteopathic Pathologists. I'm also a member of the international group of pathologists throughout the world, and have a card in that group. And we very frequently have meetings together during the year. And so there's absolutely no difference. There may be slight differences between clinical medicine because we, in my terms, we have an extra modality of therapy, which is manipulative therapy for lesions that involve the nervous system and the musculoskeletal system, to be exact. And the allopathic clinical people don't quite either don't quite understand it, or they don't feel that it's that important. And so other than that, why, it's relatively similar.
Dr. Starkey, you graduated from Kansas City, didn't you?
Yes, I did.
What year did you graduate?
I graduated in 1960.
1960. Did you go into private practice as a general GP?
Following my internship. I took an internship at the hospitals there at the school, and a year later I intended to go into a general practice, but thought that I might have some talent for surgery. So rather than to enroll in a surgical residency, I thought I'd enroll in a residency in proctology, which is rectal surgery.
Right.
And I thought, well, if I can learn to do rectal surgery pretty well, then maybe I got some talent to do general surgery. But in the process, and during that year, I decided that I would rather just go into a general practice, which I did for a number of years until I decided to take a residency.
Well, I was getting ready to ask you, what directed you into the path of pathology?
Well, to me, when I was general practice and doing rectal surgery, it seemed as though you got to a point where you were doing things in rote. You learned the certain things, you did the certain things, you did the same thing day in and day out, or every other whenever it occurred. And I got the feeling that, well, I'm not picking up books. I always wanted to learn more. And I felt that I was getting myself into a position whereby if I was looking at a patient, listening to them with interest, that oftentimes that I might be able to make a diagnosis without even bothering to examine them. And I thought that's bad. I didn't like that. So I felt if I can go into some field whereby it requires a lot of challenge and searching and seeking and so forth, I'd feel better about it. And the closest thing that I felt at the time, because of age, would be pathology. It would be somewhat like a 9 to 5, and I'd have ample opportunity to do this type of work. I rather liked clinical medicine, internal medicine, but now you're up and down all hours of the day and night, and my age was such that I didn't quite feel that I wanted to do this.
Well, that's understandable. Tell me something, Dr. Starkey. I don't want to put you on the spot, but down through the years, you've taught about 10 classes or so around here. Do you have a favorite class?
Well, I do have a favorite class, but oddly enough, I can't exactly remember one class in which I got the Teacher's Award. That's dated. What is it dated? I can't remember. 77, I think.
I believe it's 77 or 78.
Yeah, well, I think it's 77. Yeah. So that would be the class.
That would be the class of 77.
Yeah, that's right. That's right. Yeah, I was trying to make it 2 years ahead, but that'd be the class of 77. And they were all. I can remember many of them. Names not so much. But they were an excellent class. They really were eager to learn, and that's particularly noticeable if you're having a laboratory session with them.
Right.
Because we'd worked. The laboratory sessions had been worked out in such a way, almost automatically, in which slides and tissues that we would be looking at would be a sort of a review of what we'd lectured on during the 4 hours during the week.
Let me test your memory and see if we've got the right class. And I'll just mention a name, for example. I know he was in the class of 77. Dr. Carlisle Holland. Was he in that class? You know Dr. Carlisle.
I know Dr. Holland, but I'm not sure. One that comes to my mind that was in that class is Dr. Reed from Arkansas. He practiced in Arkansas now.
Well, he's at 78.
78, huh? Well, now, he used to always come over
right,
there.
He's down at Ashdown, Arkansas.
Yeah, he used to always come over there and talk to me.
He graduated in 78.
78.
So you would have gotten it. That'd been 78 instead of 77.
Yeah,
see, that would be your, in other words, the 74, he came in 74.
Mm-hmm.
The class of 78 came in 1974 when you came.
Yeah.
And you saw them all the way through.
Well, who would be the seniors in 1977? Because I was at the banquet.
Well,
there when I got that plaque.
They came here in 73.
They came in 73. But at that particular year, the sophomores were the ones that were giving me that plaque.
Well, that's true. You're right.
Yeah.
You're
so
right.
It would be that sophomore class of 77. And I can't really in my mind pinpoint just who it was.
Well, that's.
Why don't you take a look and see?
I'm not sure, but you mentioned Dr. Reed.
Now, Dr. Holland.
Stephen Wayne Reed. No, he graduated in 79, so that would have been right. He'd have been a sophomore in 77.
Right, yeah, okay.
I was wrong. I misled you because he graduated in 79, not 78. Yeah. So.
And another one that comes to mind, he was married. I probably wouldn't want this on there afterward. He was married to a little girl, and he had been a lab tech, and they ended up divorcing, at the end. A big fellow, and I can't think of his name now. Forgotten it. But anyway,
that dates it though.
Yeah, they were a good class.
That'd be the class of 79.
And one thing to me, whether you put it on or not, is that you can always tell. These are the people, as I said, would always seem to be interested. But the instructor never got a hard time. Everything would just sail smoothly. And like I used to tell them, I can't hardly wait to get in to start lecturing and teaching. It was so pleasant.
Uh-huh.
The atmosphere was one of learning and teaching and being pleasant. There are other classes that I've had that I don't care if I ever see again. Poor old Tom Whittle, that just died.
Right.
That was one class that I cussed. He cussed everybody class. They were so glad to get rid of him. They didn't want any of them ever to come back again.
You're referring to the late Dr. Tom Whittle, who taught psychology
yes,
during the first few years.
Because we used to have some classes, more than just pathology lectures and lab over in that little building.
Mm-hmm.
They had a number of basic sciences were lecturing over there, and Dr. Whittle had a class of some sort over there, and I remember one day he asked me what I thought of this given class, and I just kind of shook my head. I don't want to say too much.
Right.
He said, well, I hate the, and he went on to say a few choice words. He said, I'm glad I'll never see him again.
Well,
But they were a bad class.
Well, in sharing that, we appreciate very much. Something else, I'm just wondering, do you have some kind of like Reader's Digest, I guess, unforgettable experience?
Well, I suppose I could give you some anecdotes. They involve a lot of pathology, which might not be the proper reading for people.
Well,
I recall during my residency program, this was at Kansas City, where I began the program,
Right.
and then finished it up at another institution in another state. But students were required to be there in the amphitheater, and they sat, like that, on the table, and at that particular stage of my residency, I was allowed to do posts, but very often one of the pathologists who was involved with that particular case would do the posts, and I would assist. And oftentimes the students, some students would be allowed to do this. And this particular pathologist was a little fellow, and he always wore a little black apron and rolled his sleeves up. He wasn't in scrub clothes, and he's quite a talker, and kind of a funny little fellow, and had a big surgical light up here, and then the body's laying here opened and all that sort of thing. And he was lecturing to the students up there, now this is such and such, and look at this lesion, and he just cut the liver out, and he always says, this is a pretty good size, and it was a big fatty liver, probably an alcoholic, and it had cancer in it too, and he was explaining this, and he went to take it back from the table to put it on a scale to weigh it. You weigh them all. It slipped out of his hands and lit on his feet. And he looked down and says, God damn it, I just bought these shoes yesterday. And that liver just splashed all over the floor. And it's kind of sickening,
Yeah.
but it's a kind of joke. What you call them, occupational jokes.
Right, yeah.
And another time I remember doing a post, I was doing this post, and I don't recall whether I was a resident or not. But here again, this big surgical light, and we had students here, and the room was rather small, and everybody clustered around here, and this hot light coming down, and here's this body had been opened, and the vapor, I began to see vapor coming, and all of a sudden, pop, and glass flew. It had blown the light up. Here, that moisture from the body had gotten up there, got heating, and it hit the bulb, and just blew all overhead. It went with a big bang. It just made you jump. And so we couldn't find a light bulb put in there, so I went in and did the post another time. One more anecdote. I was called in to do a post. There, they called you in at any time. And I had hired a black fellow who owned a funeral home to go there at 2 or 3 or 4 in the morning and do the post and just leave the tissue for me the next morning. And with any notes that he might have, so that I could now make a diagnosis, which is not a very good way to do it, but gee whiz, 2 or 3 in the morning to go do and spend 2 or 3 hours doing a post. It's a little unnatural. Well, anyway, I happened to go. This fellow was on vacation, I think. And so I went all alone. And this is about 11:30, 12 at night. And everything's dark and quiet every place. And although I'm not one easily scared, I didn't like to go down that room because it wasn't the prettiest room. It was an old building, and the morgue part, or where the body was kept, was just like a little meat cooler. You couldn't hardly get yourself on the side in there to get a hold of the cart to bring them out. And then I got it over the table, and the poor soul on there happened to be a heavy white one. And our autopsy table had the covering on it that had holes in it, to keep things to drip right down in. Well, I had moved the cart over and tried to level it off for that, but there was a little edge to it to get the body. And I'm dealing with a woman who must have weighed maybe 180 pounds or so, and I'm a little fellow at that time, and I'm trying to get her on this table. and I almost dropped the body on the floor. I had it out here, I'm waltzing around with a dead woman in my arms, and finally get her on the table. But the minute I got about half of her on the table, her flesh sunk in these holes, and of course she had a big butt, you know, and it's all flaccid material, and sunk in the, I couldn't budge her. And there I am with one arm around me this way of her, holding her on the table and making incisions and trying to get the organs out and make a diagnosis.
Oh my goodness.
And it was just the hardest job. Yeah. And every once in a while, and of course you knew better, but we're talking about a relatively small room and no one around but myself, and this spotlight up above on the body, and the arm of the lady, one arm wrapped around my back, and right in the small of my back, and I am not normally afraid of the dead or anything, but suddenly I began to feel a little squeamish about all this, and about the same time there had been a rigor mortis set in, and about that time that arm began to slide up my back. And for a fraction of a second, I thought I had opened a live person, and here, what am I going to do with all these organs laying around on the table? And there are a lot of others we could talk about, and that's just...
well, do you recall any here that you had with the students, and any unusual
students?
Experiences in any way?
Oh, not such that I just described, because we weren't doing autopsies at that time. I really can't, for the moment, think of anything other than some of the characteristics possessed by some students and their peculiarities that oftentimes one had to adjust to. And I recall one small incident. I don't know why it ever happened, because I tend to be relatively stern in class. I'm not without humor, but there's work to be done. And I happened to go up to the podium, and someone had placed on the podium one of these girly magazines, and had opened up to the centerfold with, of course, a beautiful young lady without any attire. And I all of a sudden, when I saw that, I also suddenly noticed there was complete quiet in the room. So I thought, well, they expect me to either explode or laugh. And I thought, well, it's going to be a bad day. I'll go ahead and laugh about this whole thing, which I did. And it made them relax. And they all roared and thought that was a big joke.
Right.
And there were a few other things, I guess. One student one day, we didn't have many microscopes early on, and one student had been, during laboratory, had been rather talking a lot rather than paying as much attention as he should, and I usually walked around when hands were raised to come give that individual student a little help and description of his slide and for this or that. And I made some remark to the student who was across the table that you ought to go ahead and study your slides, because we may well have an examination on this. And he said something, well, I'll know it, or something like that. And as he got up, somehow or other, he got his arm caught in the cord, the light cord to his microscope, and dragged the whole thing off the table and onto the floor. And fortunately, even the lenses, they were not hurt. But having only about 7 microscopes for the whole group, this was, I think, the first year I was here, any damage would have been catastrophic, because nobody would give me any money to buy a microscope. And so, but fortunately everything was all right, and we were able to make use of the scope. And I think the student was right in what he said. He did well in an examination about at the end of the week.
He knew what he was talking about.
He knew what he was talking about.
Oh,
yeah,
good.
that's right.
We were talking a moment ago about favorite classes. I know, Dr. Starkey, that you may not consider it your favorite class, and I'm sure you're aware of this, because yesterday you were given a reception here in the atrium, and I think it was a very fine affair at noon, and I was a little apprehensive because when I was told about it originally, when I learned originally from the junior student, the class of '87, you see, is now the current junior class, kind of sponsored this and ramrodded it, and one of the particular young student doctors, Leah Holly, had mentioned to me that what was going to happen. I was a little apprehensive because I didn't think she said was going to have a reception at lunchtime, and I thought, well, gee whiz. A reception at lunchtime, I don't think you'll have enough to have a nice meal, and so forth. I never questioned it to her, but it just thought came in my mind. But I told her later yesterday afternoon, and she made a believer out of me because it was just like an 8-course meal. There was plenty to eat, and they had a lot left over, and it was excellent, and everybody thoroughly enjoyed themselves, and they had plenty to eat too. So I do know that, speaking of favorite classes, I know the class of '87 must think an awful lot of it.
Yeah, well, that's, I suppose I might just recant that previous statement to some extent, because I think all classes to me were favored in the sense that there were always in any given class a certain group of students that were interested in what they were doing, wanted to learn, and had, I'm a rather old-fashioned person, and I appreciate courtesy and good manners and so forth, and I suspect that all of the classes that I've stood before could be classified as favorite class. And I certainly appreciated what they did yesterday, and was not aware until a couple days before this affair took place that it was going to occur. And so I was pleasantly surprised. My wife was extremely pleased, and there were a few times I was kind of moved to tears because of it.
That's understandable.
And so consequently I wore my dark glasses through the whole affair.
Well, and I got a great bang because you're about to leave us here, and you're about to move, as I stated earlier, back into the hills of Missouri, up near Bull Shoals, somewhere up in there, close to the White River, and that's, of course, most people know something about that country, even if they haven't been there. They've read about it, and it's very beautiful. And we envy the fact that you're going to be able to sit out on your porch and look down into the beautiful space beyond, and really enjoy yourself. And I think you said something about your own department gave you a telescope, so you'll be able to use that a little more eye power, so to speak. So we're looking forward to visiting you sometime up in that part of the country. You'll be leaving then very shortly.
Very shortly.
So you've had a very distinguished career here at TCOM. You've made a lot of friends, and I know that it's hard to sometimes keep friends after you out of sight, out of mind, of course, but we're going to think about you. You left some good footprints here, and you made a great contribution to this college, and I, for one, am proud to have known you.
Well, thank you. I appreciate it, and I'll be coming back every so often and invite all the folks here, if they have an opportunity, to come see me.
Thank you, Dr. Earl F. Starkey.